When we speak with patients and educate them on the chemotherapy that they're going to receive, we go over very specific details. We tell them their dosing that they are going to get. We tell them how long the infusion is going to take. We tell them what labs we're going to get before. Chemotherapy, it can harm blood cells, so we always make sure that we check labs before they're receiving their chemotherapy because we don't want to put them in any danger. Say if their white count was too low or they had chemotherapy-induced neutropenia, which puts them at a very high risk for infection, we will hold the chemo, or we have special medicine that we can give, say as a fertilizer for white blood cells, to get that back up to a safe range so that the patient can continue with treatment. Sometimes platelets can drop low, and there we have to be careful because low platelets can put you at risk of bleeding. Hemoglobin can always drop low, and that can require blood transfusion. Some of the side effects that we go over with patients, of course, the most common ones being nausea, vomiting, diarrhea, constipation, and fatigue. Those we go over in great depth with our patients. We have specific medicine schedules that we have to prevent nausea, schedules that we give them to take specific medicines at certain times for a certain amount of days after chemotherapy, things like dexamethasone, Zofran, and Compazine. So fatigue being one of the most common side effects from chemotherapy, that's where therapists can come in and really help us with this. Fatigue it can get worse while we're doing chemotherapy. Like I said, it's a cumulative effect, and it's the only cumulative side effect of chemotherapy. And with our patients, it can be beneficial to get them into a therapist early because then they can see their baseline, and they can see where their fatigue is affecting them as they go on with treatment. Therapists can do things like teach them energy conservation. They can help with cardiovascular rehab, and really just help the patient adapt to their new level of energy as it is being decreased due to the treatment that we are giving them. Some of the red flags that I would look for as far as fatigue, if you really notice that the patient is extremely lethargic or more fatigued than you would expect, that may be a reason to call us because we would always like to make sure that their blood counts are okay. Low hemoglobin, low white count, that can also cause fatigue as well as chemotherapy, but we would want to rule out something like that as chemotherapy can cause the blood counts to drop, leading to fatigue.